Shadow Minister of Health and Wellness, Dr. Alfred Dawes, underscores the project has been plagued by escalating costs and indefinite variations in scope. From a budget of a few $100 million in its inception, the project is now at a staggering $21 billion. Dr. Dawes expresses heightened concern, noting that a few years ago, his predecessor, Dr. Maurice Guy, suggested a $12 billion budget for the project, but his proposal was dismissed.
The pushback was that where was that ridiculous figure coming from? What would cause such an escalation to move from $4 billion to $12 billion? Here we are now looking at $21 billion. And if 12 billion was rubbished as a ridiculous claim or a ridiculous estimate, why is it that now $21 billion, almost twice that amount, is being looked at as justified? Something is not happening. Something is not adding up.
He attributes the escalating budget costs to corruption.
There is corruption present. And corruption has siphoned off billions, maybe, if not of dollars, that we will never, ever be able to reclaim. There has been massive wastage. There have been people who have gotten tremendously wealthy, who have profited from the sufferation of patients who have not had a proper type A hospital in the Western region over the last 8 years.
Dr. Dawes contends that the $21 billion could have been better utilized by allocating it across the entire health sector for a more comprehensive impact.
If you're talking about 21 billion, Portmore could have a hospital, Spanish Town could have been upgraded, KPH could have been upgraded, Lucy Hospital, Falmouth Hospital would have been upgraded as well, and Ocho Rios could have had a full-fledged hospital. So when you talk about the opportunity cost of this massive wastage and cesspool of corruption, it is going to have far-reaching implications for generations of Jamaicans who could have had a state-of-the-art healthcare system. But instead, what we have is a massively expensive refurbishing exercise of a hospital that should have never been built in Jamaica in the first place.
Efforts to reach the Minister of Health and Wellness, Dr. Christopher Tufton, were unsuccessful. Renaldo Adams for CVM News.